Understanding children's mental health. I chose this topic because it means a lot to me. I have a teen with mental health issues, and the way I grew up in the system, I saw a lot of mental health issues with my peers. I have also struggled with ADHD all my life and PTSD my adult life due to the traumas of my youth. The mental health of children has a big effect on their overall growth. Mental health problems can make it harder to control your emotions, make friends, and learn new things. Early help is very important because untreated mental health problems can cause problems for the rest of a person's life, like having trouble making friends, doing well in school, and keeping a job. By focusing on kids' mental health, we can push for preventative steps that help them grow up in a healthier way. Kids and teens are becoming more aware of mental health problems, and attempts are being made to remove the shame that surrounds these conditions. I chose this topic to add to the conversation about how important it is to know about mental health, so that parents, teachers, and healthcare workers can spot early signs of mental health problems. Encouraging open conversations to create a more supportive setting for kids and their families, making it easier to get help when needed, and lowering the shame that comes with asking for it. Poverty, school access, and family relationships are all social factors that have a big impact on a child's mental health. Working on these root causes is important for mental health. By talking about this subject, we can bring attention to the need for a complete method of mental health care that takes into account societal and financial issues and supports rules that make sure everyone has equal access to mental health resources. This knowledge can lead to changes in the system that makes things better for people who are fragile. Disturbances in thinking, emotional control, or behavior that are clinically severe are characteristic features of mental health disorders. Discomfort or impairment in critical areas of functioning are often linked to it. A wide variety of mental diseases exist. Mental health problems and disorders are interchangeable terms. The second one encompasses a wider range of mental health issues, including psychosocial disabilities and other mental states that are linked to substantial distress, impaired functioning, or the possibility of self-harm. The ones listed here are the more common ones, and although bipolar is usually more prominent in young adults, it is found in children who usually have one or two parents or grandparents who have been diagnosed with it. Anxiety and depression affected 1 in 8 people worldwide in 2019. In 2020, COVID-19 elevated anxiety and despair considerably. In the first year, estimates showed a 26 and 28% increase in anxiety and serious depressive illnesses. Few mental health patients receive effective prevention and therapy. Stigma, discrimination, and human rights violations prevent many from receiving treatment. Nearly 20% of youth experience mental illness. Fewer than 2/3 of mentally ill children and their families receive treatment. A new systematic analysis explored parents' barriers to professional mental health care for their children. It examined specialist waiting times, charges, attitudes towards service providers and psychological treatment, mental health knowledge and understanding, not knowing how to get help, and familial conditions. Stigma, embarrassment, difficulty identifying problems, and a desire to solve them oneself hinder most young people from seeking help. As is known, high demand for professional treatments, limited availability, and long waiting lists restrict children and adolescents from receiving condition-specific mental health therapies. Recent endeavors have expanded professional, educational, and public resources. There is a lack of evidence for quality indicators in adolescent mental health treatment worldwide, according to the World Health Organization's global standards. One of the challenges is reaching a consensus on the best ways to measure quality in mental health. Substance misuse, early school dropout, social isolation, long-term unemployment, and significant financial burdens on families, communities, and healthcare systems are all outcomes of mental health issues. Adolescents with mental health issues have worse treatment than other age groups, even though adolescent mental health is currently receiving a lot of attention. Comorbidities, mistrust of the health system, and bad health outcomes are the result of subpar health care. The teen's risk of mortality rises as a result of subpar health care administration, treatment, and follow-up. Families are vital to patient safety and harm reduction as care team members. Partnering with families and patients improves mental wellness, like symptom resolution with pain, blood pressure, and glucose levels. Family observations can improve patient care and safety and benefit staff and clinicians. Families can then cooperate with nurses to follow the care plan. Burnout in healthcare practitioners affects providers, patients, and organizations. Due to the specialized nature of caring for children who are often considered as fragile, the strong potential for empathetic engagement, and the inherent difficulties of family interactions, this subpopulation may be different from adult care nurses. Nurse demographics, work environment, and attitudes affect burnout. Burnout affects nurse retention, well-being, patient safety, and patient family satisfaction. Recent years have shown that while jail and detainment are necessary for a small percentage of minors, long-term confinement generally leads to relapse and persistent offending. Community-based alternatives reduce reoffending, including for serious and aggressive kids. 4 systems focus on education, child protection, juvenile justice, and mental health. Each of these systems has a way for adolescent participation when their needs match its capabilities and goals. Recent communities have recognized that this type of separate service delivery does not always meet adolescent requirements. Adolescent offenders often require services that many public systems, if not all 4, making treatment difficult. Families, communities, and children all bear a disproportionate share of the financial burden associated with mental health issues in childhood. For instance, outpatient services for teenage mental health concerns that were covered by the government had an average cost per episode of $2,673 and an average of $14.34 of service interactions. Psychotherapy costs an average of $1,079 per episode. Evaluation is $683 per episode. Collateral services is $227 per episode. Case management is $161 per episode, and pharmaceutical support is $186 per episode. More frequent doctor's appointments, hospital stays, and specialist care are common among children whose mental health issues go untreated. Large sums of money may be required to cover these heightened medical expenses by families, insurance providers, and the healthcare system as a whole. For instance, if someone had intervened sooner, a youngster going through a mental health crisis might not have needed expensive emergency psychiatric treatment that could have led into going to a residential treatment. Depending on school screening rates, screening expenditures per student ranged from $8.88 to $13.64. 72% of referred pupils received supported services within 6 weeks. Cost effectiveness per successful linkage was $416.90 when 5% of pupils tested positive and $106.09 when 20% did. Calculations of the percentage of kids screening positive were accurate within 5%. School districts can allocate resources based on school-based mental health screening program costs and effectiveness. Mental health parity laws have greatly improved child access to care by covering mental health services on par with physical health services. This advancement has greatly reduced mental health treatment stigma and encouraged families to seek help for their children. Funding for community-based services that provide early intervention and continuous support remains lacking. Many families still lack resources, especially in impoverished areas with few mental health providers. More comprehensive preventative care policies that emphasize education, early detection, and intervention are needed. We can improve children's mental health assistance by investing in preventative approaches and community services, improving long-term results and quality of life for young people and their families. Professional nurses use education, screening, teamwork, and policy advocacy to improve children's mental health. Nurses may teach families about mental health so they can spot indications of distress and seek treatment. Regular pediatric mental health exams identify potential difficulties early, allowing for timely intervention. Working with schools to provide mental health resources improves child support systems and promotes inclusion. Nurses can also advocate for mental health service funding and resources. Support groups for afflicted families foster camaraderie and empathy, while cultural competency ensures that care is adapted to the varying needs of children from different backgrounds. This comprehensive approach tackles acute mental health difficulties and builds a supportive framework for all children's mental health. In conclusion, my own experiences and the larger social environment make it clear that children's mental health is an issue that demands immediate attention. Having dealt with my own mental health issues, along with seeing my children suffer, I can attest to the need of providing young people with early intervention and assistance. Preventative approaches and supportive environments must be prioritized due to the tremendous influence that mental health concerns have on emotional control, social interactions, and educational outcomes. Even while mental health parity laws have made some headway, there are still huge funding and resource inequalities in the community, especially for low-income families. Making sure kids get the medical attention they need by getting the word out and pushing for laws that tackle monetary and social obstacles simultaneously. The elimination of stigma, the promotion of open dialogue about mental health, and the equipping of parents, teachers, and healthcare professionals to identify and address early warning signs of distress are all critical. A healthy future for everyone is possible through improving children's and families' well-being through a comprehensive strategy that includes cultural competency, community-based assistance, and similar factors.